educational center of my hospital that I recently joined in, which is an emergency department. And I have been working in emergency department as a new staff for, I'm thinking about 2 months now. I got a little hang of it, but of course I'm still struggle a lot with, it's depending on the cases. If I ever take care of that one case, similar case before, and I got this like right on the bat, but mostly I need like some time to think, which in emergency department you really don't have time to think. Need to be spontaneous, which I'm trying myself to the best of my ability to do so within that 2 months that I have been surviving in the ED. So today at least they sent me to the I don't know what they really call it, but it's the whole day long of the education material, which will be in the, I reckon is like a lecture room or something. And I got my book back. I want to make sure I got my book back. Yeah, I got my book back. I got my computer charger. I don't know if they might need it, but I'm pumped. I'm prepared. I'm ready to roll. I'm on the way. Like I got like left about 50 miles. It usually takes about 55 miles from my home to that educational center. Of course, I'm very bored, so I'm making this video, talking to myself in the car like crazy. Yeah, I got my coffee. I got my chip, which is Burmese mala aloo jo, Burmese spicy chip. Yeah. So I don't have my lunch box. I reckon they're gonna give us some lunch, or I have some money to buy some lunch if they are there for any cafeteria, I reckon. Yeah, it's the whole day process of the education, so wish me luck. I'm not really good at studying the whole day. I'm the person that I have to go, I have to study a little bit, then hands-on, study a little bit, then practice. And I learn, everybody learn differently, but I learn things from me doing it. Because just studying or trying to get things in my head is not gonna sustain when I really need to be like needing that educational material on the floor, to be honest. So it's really beneficial for me that I have been working in emergency department for about 2 months before I get to this education, so I can somehow link the practical and education part together. And I'm not gonna lie, it is a tough journey. I feel like I became a new grad again, new graduation, just fresh out new grad nurse again on the floor after 10 years being a nurse, because all I have been like as a nurse is in occupational health and home health, and I've been in med surg for like 8 months before I come down to the emergency department. So at least that helps me. At least I'm not quite sort of struggling much of that basic medication or the workflow layout, or how to use some of the medical devices. But again, it was quite a journey. Okay, it was quite a journey. I'm so sorry about this owl right there. That's my badge. Yeah, and I also recently found out that if I speak in Burmese, people can still go to setting and translate it into English. So if you are somebody who found this video and subsequently you found other of my videos part of the music that I can play in the car, or solely the purpose is doing of this video is my life journey recording, documentary, like a life library kind of thing. So if I got two sons, and that two sons, I don't reckon they are really into nursing, but maybe their kids and maybe their grandchildren, maybe my great-great-grandchildren see this video and maybe be inspired a little bit of, not sure. However, that's the whole purpose of it. Not that I know too much about whatever, but if I know something, I'm ready to share with people, if not breaking any other people's privacy, like anything about like my own experiences, or anything that I know that, you know, you're in the same situation with me, that you need somebody, that you just need like some sort of verification or some sort of like confirmation. Hey, somebody there like me, struggling, becoming a nurse in the emergency department. I've been there. So yeah, other than that, I don't want this video to be too long, so I'm gonna share more about what I have learned from this, of course, the lectures or study or the education that they give me, and probably constantly I will be sharing what I know, what I feel like, what I kind of want to let out, because usually I don't talk about work to my family because they are not from the medical field, and let alone they don't know much about the U.S. healthcare system, which I am still learning about U.S. healthcare system. Because some of you may know that I am originally from Burma, and I got my education from Singapore. And so yeah, even though I've become a nurse for 10 years, and all that experience that I have been, it's not quite useful being in the emergency department right now. So yeah, if you are in my same situation, honey, you got this. There are a couple of times that I cry in the bathroom without anybody know. Even though I am right now 36 years old, full-grown woman that been a nurse for 10 years, yes, I still cry in the bathroom without anybody know. But it's just to letting the emotion out, whatever that solid stuff that making me not be able to breathe, and I just crush it for the moment that I got a few minutes of the bathroom break, and that's it, just for me, not to seek for mercy. So I'm not letting people know about that mostly. But if you are the person that you have to go to the bathroom and cry it out loud a little bit for a while, it's fine. And also, I would like to talk about my preceptors. I have a few preceptors because I only work in certain days, and also certain days like Friday, Saturday, and Sunday. So not every nurses work on the same schedule with me. So I don't have a one preceptor only. I have more than one preceptors, and every nurses have their own style of working, own style of charting, own style of thinking. So I'm so glad that I get to learn from more than a few people, the way they work. I get to pick and choose the best of them, and that's I'm very grateful for. And when I was a very, very new grad nurse, I was in Singapore. There's one preceptor that I always kind of scared to go together. Stuffness. I won't say the name, but if you are from the same hospital that I was trained from, you probably know. But I'm not gonna say the name for privacy. It's all for respect as well. And she is the hardest one that pushed me. But the way she trained me is that she would look at me, and that made me so scared and shake and drop everything, that I know I'm doing something wrong. She won't say anything. solid thing stuck in my throat for some time, few days or a week before I figured it out what it is. So that don't sit well. But at that time I was very, very new, so it's really hard for me to find out what even though if I'm on the right track. So yeah, like I said, since I've become a nurse for a while, and I kind of noticed that some preceptors style of teaching, some are really hard for the students, some are hard enough that you will remember the circumstances vividly and you remember it for the rest of your nursing career. And recently I've been having preceptors in emergency departments. Nobody that I could be complained about, because everybody's doing really great. And that one preceptor, she would let me do everything, and she would tell me what I'm doing wrong, and she will tell me like what I could be doing wrong, even though I'm not doing it wrong. I like that style of teaching as well, because at least, I will be looking out for, it is a little bit like a spoon feeding, you would think, but again, because we're in the emergency department, it's really fast paced, and didn't have time to kind of sit and think and what do I do wrong, and then learn 3 days later, and then I've been making a mistake for 3 days. So we don't have time. So I like the way that preceptor do the precepting part, which she would tell me, hey, this kind of medicine, that's what you look out for, and she'd tell me the answer, and then for the scale part she would let me do, and she would let me, because I've been a nurse for a little bit, so I'm not very bad at IVs, but probably the handling part of that equipment and stuff, she will kind of remind me, hey, the way you do this will be harder, and the way I do this will be easier, blah blah, just stuff like that. There's another preceptor that I encounter. That person will let me do everything, and also that person will not looks like that preceptor kind of give me about 10 minutes kind of frame time for me to work on stuff, and then if I'm not done within that time, and that person will come and, well, I would say like either rescue me or will do the part that I'm supposed to be doing. So I'm kind of slow still, because I'm from the inpatient, so even I do IVs, I'm not fast enough. Like, I get it, but I don't think I'm very fast like other nurses in the ED, like pop pop pop, then so the time frame that I was given usually got to be rescued again. I mean, like, it's not enough, I would say, which is not good, because in emergency room, like I said, you didn't have time, and you just have maybe one time to think and one time to if you're stuck at something and there's too many things to do after many things, like waiting for you to get it done. So if you're stuck at an IV, or if you're stuck at something like patients asking you questions, or person will at least tell me what, I mean, that's at least from that person I got the style of flow of work. How, okay, like when you first come in, what to do, what you should be doing. I mean, instead of you do your style and that person will give me the style of working, the flow of working, which I appreciate so much, so much, because I want to be making sure that what I'm doing is what experienced ED nurses will be doing it. You know, I don't want to be like doing it in my way, which will customize it to my way later on, of course, but I want to make sure that I will be doing what an experienced nurse will be doing. Yeah, I like the part that person take time, sit down and review some of the basic stuff that I've been forgetting, which I need it right now, but I've been forgetting for 10 years. Of course, we all pass NCLEX, but you know, by the time that you have to apply that, knowledge to the floor, and I struggle. I'm like, I have that neurons fire and travel down to, you know, from the cell body to the travel down to the next cell body. That's where I kind of find the connection. I'm stuck. I'm like, and I choke most of the time when people ask, when that person asks me questions, because I mean, I don't know why I do that. Maybe my very first preceptor that I've been to when I was in the new grad, there's always a flashback, and she always kind of stare at me. Then I choke and drop things. That feelings come back. It's just like, how do I even put it in the way? Like, it's just like you got traumatized in the childhood, and then now that 10 years later you in the different country and you become in the different situation, even though it's 10 years later, and you starting to like have a flashback of your abusive childhood. You know, you see what I'm talking about. So anyhow, whenever I got that kind of moment a little bit, and even though the current preceptor don't do that kind of thing, but some reason I just got that flashback and I choke. Things that I want to say won't come out from my mouth. Things that I kind of know, it come out even wrong from my mouth. Like, you know, probably I said like all the opposite thing. But again, I gotta splash off that encouragement every now and then. It is really funny to even receive that, because I don't think I know myself very well, that I don't think I've been doing really the best that I could, I would say. Yeah. But anyhow, I feel bad. Because, you know, I know myself that I've been a nurse for a while, and that's the worst part that I can't sit well. Because if I'm a new grad, with that splash of encouragement, I'd be like flying through. But since I know myself that I'm like, why am I too slow? Why am I too stuck? And sometimes I think like, why do I even like keep switching specialties? Because I've been in the occupational nursing, and I almost became a nurse manager from that. Then I took it down because, you know, I don't want that kind of non-bedside nursing. That's not that I want to do for my life. I got that for 3.5 years, and I love it. I'm doing it well, but you know, my guts tell me that, hey, switch the specialties, because you don't want to be like on the top. You want to be on the floor back again. Ciao. And then I went to home health, and home health This is 7 a.m. in the morning. Nice. I'll be there on time. So then I was there in home health for like 7 years. The reason why is that because it just took me about 3 years to get my BSN, but the other 4 years I got babies, I got life, I got a lot of crafts in the life. But then when my baby, the youngest one, right now he's in the pre-K and almost going to the kindergarten, and I'm like starting to think like, of course home health got a lot less money, and also still got some critical thinking, but you only taking care of one person. I mean, home health, what I'm talking about is a private duty home health nursing. So I go out to the house and take care of that one person and come back home. So is if you want like emergency department kind of material, you're not gonna get it from home health, the private duty. So I know that. So I apply for because I'm ready. The kids are fine. Kids going to school, and I don't need me 24/7 at home. So I'm starting to. I don't think I waste any time at all in my life, but just life happens that 10 years, I feel like it's just wasted. Like non-bedside nursing. Home health is bedside nursing. Correct me if I'm wrong. However, but it's not like 100%. 100% of that. The best of you won't come out on that setting. So yeah, anyhow, I applied for the job to the hospital. Then when I applied for the job, and I was like, there's 3 areas that open at that time. One is medical surgical floor, another one is ICU, another one is emergency department. And I think of it myself. I have been in medical surgical in Singapore as a new grad. But of course it's in Singapore. Even the medical device and everything not the same. The whole system not the same. Okay, but at least I know the flow. I know the flow and the flow. So instead of going to ICU and the emergency department, thank God I did not choose any one of them, and I choose medical surgical. I took the baby step and was in. So when I go there, and my intention is to work there for 1 year. Then when I get it, of course I want to go to ICU or ED. And then one day I got floated down to ED, and I started to see what nurses on the ED do. And of course I already know they are cool, and the cases over there is cool because you don't just got geriatric patient. You got like a 40s of baby. You got like, I mean, different cases. That in the life is happening. I think working in ED at least is an eye-opening what's happening in the life. So then I started to look for the job opening, and there's one opening in ED for the days that I would like to work. So I just go ahead and apply, and yeah. So when I got it, I feel so blessed. First of all, because I took the baby step in the medical surgical first before going to ED, because going to ED straight will just kill my soul. Okay, because even right now I'm struggling to be, for sure. But yeah, to wrap the whole situation, I love where I'm at, even though I cry like a baby in the bathroom a few times, which no one knows. Now you know. So if you do that, you're not crazy. Here, you got your partner that crazy like that too. And I still love and smile and do well and go back to work and starting to be better a minute after I cry. It's how crazy. But if I were a new grad, one or two that I get. The rest of the patients, I can't get IV in. It's devastating. It's frustrating. I mean, one thing that you're good at, you're not good at anymore. I mean, on things just stacking up for you to just crush. So it's normal. It's normal. I mean, if not normal, let me know. But I think it's normal because I'm still surviving. I don't feel like I want to end my life right now. Oh gosh, it's funny. So yeah, that's just it. The video is quite long. Guess what? You can just pause and stop anytime you want and subscribe anytime you want. I mean, like right now. So at least you got somebody struggling like you. Yeah, but I'm gonna look at this video again for myself 1 year later and see how much funny moment that I have and how much improvement I have. Like I said, those videos are solely for me and my soul and my documentation. So yeah, goodbye for now. I'm gonna start at 20 miles more now to get to the educational center. So I am going to listen some music